Hello, lab experts. Welcome to the Diagnostics podcast, the podcast where we discuss everything medical laboratory science in Africa and around the world. In today's episode, we sit down with Progress Promise-Birah. Progress is from Rivers State, Nigeria, and currently lives in Lagos. He's a medical laboratory scientist who graduated from the University of Calabar in 2018. Did his internship in Federal Medical Center, Yenagoa, and is currently working with SynLab Nigeria.
The place I worked, actually, the turnaround time for most um, cultural tests, microbiological cultural tests, it takes up to more than a week. And imagine someone waiting on that result to get treatment. It's just.
In today's episode, we'll talk to Progress about laboratory automation in maintenance of standards. Without much further ado, let's talk MedLab. Once again, hello lab experts. Today, as I said earlier, we're here with Progress Promise-Birah. Promise, how are you doing?
I'm good, thank you.
So you wanted to talk about laboratory automation today. We're going to get into that, but before we get there, can you tell us a little bit about yourself?
Okay, my name is Progress. I'm from Nigeria, Rivers State, precisely. I finished my university education in 2018, University of Calabar, Medical Laboratory Science. Did my intern in Bayelsa Federal Medical Center and came to Lagos for my national youth and decided to see what Lagos would be like. So I'm currently practicing in Lagos.
And how are you finding Lagos?
Well, like they say, have you been in Lagos?
Yes, I've been a couple of times. But the last time was, I think, about 3 years ago, actually. It's been a little while. Okay. It's very different from Cotonou. It's very different from Benin. It moves all the time.
It's always active. Lagos is always on the move. So, yeah, more people, more cars, less road, You have to by 4 a.m. to prepare for work.
Yeah.
For someone who goes to work every day, you may come back home, say 10, 11 p.m., and the cycle just continues.
Yeah, I guess it's because also of the go-slows. So it takes a lot of time to move from one place to the other.
Like I
That's
said,
what surprised me a lot. Yeah, when I was there, like moving from one place to the next. If you are lucky, it goes fast, but on a normal day, it tends to be, usually you have like specific junctions that before you get there, people will already tell you, okay, just be ready.
Yeah, that's true. And everybody in Lagos is, like we say in Nigeria, they are ID reds. So everyone is everyone has something, like everybody is ready to fight, everybody is ready to defend. It's an interesting place, you go out every day. It's pretty interesting, actually.
I mean, you stayed there, so it has to be interesting. Obviously.
Well, not everyone will. Not many Nigerians will tell you they will be like, most of them are like, no, I can't stay in Lagos because it's too rowdy, it's too chaotic. Yeah, most persons will say that, but I think it's cool. I think Lagos.
Now, moving on over a bit more to the lab. You said you wanted to talk about automation, laboratory automation. Why is that? It's rare to find someone that actually wants to talk about that, at least from all those we've been contacting to discuss on the podcast. So in your case, what interests you in that topic?
Okay, I'm going to give a brief history of how I fell in love with automation generally. So sometime in my 200 level, I had an opportunity to do A-levels. It was actually a scholarship thing, and we were required to do A-levels first. So I went in for A-levels, and I opted in for physics, chemistry, and biology because we were allowed to do just 3 subjects. So the British curricula was practical. It was beyond what you could just read in the textbooks. They had, in each of the courses, they had sections where you could think and apply those concepts you've gotten in the books, and even create your own experiments from scratch.
Yeah.
And it made me fall in love with physics. It really made me fall in love. So then I was like, why did I not go for engineering? The whole calculation thing, it was really, really thrilling to work with numbers and everything. But I was already in laboratory science practice. I was already a medical laboratory science student. And medical laboratory science too was something I was passionate about. So it was now like, how can you merge these two interests
Yeah.
together? And after doing some reading and some research, I found out that there's something actually called biomedical engineering.
Yeah.
It's it's a bridge between the medical laboratory scientist and the engineer, just to fuse both concepts together to that unique line. You bring engineering concepts, biochemical concepts, and something unique comes out. And I worked in quite some labs, from the least automated lab you can possibly imagine to some that are actually really automated, as per Nigerian standards. So getting to see this concept of biomedical engineering being applied in the laboratory practice, fascinating, trust me. It was fascinating. And if you get to see the working principles of most of these equipment, I was in a training recently on Sysmex. Sysmex is a brand. I don't know if you're allowed to mention brand names. So
Yeah. Right.
Sysmex is a brand.
Mm-hmm.
Okay, cool. So the instructor was trying to show us each of the components of the Sysmex and how they tend to bring about the full blood count results.
Mm-hmm.
It was like a miracle. If you have these concepts in your head, those various concepts being packed together into that component, and it brings out something really unique. It was beautiful, trust me. So I was not like, oh wow, this is actually something nice. It's something every medical laboratory scientist should embrace.
Mm-hmm.
But yes, I understand the challenges and I understand every other thing that goes on. But it was basically my A-level experience and practice that fueled my love
The interest.
for laboratory automation. Yeah.
Yeah. Now, you said you've worked in various labs from the least automated to the most automated. You added something specific. You said in the Nigerian context. What's the most automated you've seen in the Nigerian context?
Okay. I did during my internship. I did a seminar on total laboratory automation,
Mm-hmm.
and I got to encounter, or I got to read about some really widely automated labs, like automation that starts from the point of reception all
Yeah.
the way down, results dispatch, very minimal manual involvement, probably just sample collection, because I'm not sure there's actually a system for fully automated blood sample collection yet. And I know there are some countries, some first world countries that are actually practicing those,
Mm-hmm.
especially total laboratory automation.
Yeah.
But here in Nigeria, yeah, I would say some organizations are really doing good. They are really, really doing good, especially where I'm working.
It's SynLab, is that it?
Yeah,
That's interesting. It's through SynLab, I've been hearing about them like a lot. So even on LinkedIn, I hear about them also a lot.
so yeah, it was. I don't mention specific names though,
Okay.
but some places where I worked, a typical Nigerian lab business owned by an average medical laboratory scientist is you come, the most of the equipment they might just have in the lab will be the microscope, the spectrophotometer. Some persons even still use colorimeter, you
Yeah.
know, that type where you change the filters and
Mm-hmm.
based on the test you want to do.
Yeah.
The water bath, and yeah, business is good to go. So you find out that when you started, you kicked off the process of a test, and it just keeps going. If you're working on a large batch of samples, you get to see that there's this thing we do where let me just give a picture. I have like 20 tests that came in, and I have to run repeat, standard controls and the patient test. So I have a series of tubes I am arranging, identical tubes.
Yeah.
I have my samples arranged. So I begin to get the samples and the reagents into the various tubes using my pipette. Out of 10 times, you're bound to put twice into a particular tube or skip a particular tube. And the process is tedious, very tedious. Sometimes you'll be walking and probably light just goes.
Yeah.
And you're like, what's going on? There are so many setbacks.
Yeah, because it also depends on your lab, right? There are some labs where they may have hundreds of samples that they are working on. And so in that particular case, it's there's a much higher chance that at some point, maybe you lost count and then you put it in the wrong tube, but you don't want to restart. So you're like, okay, how do I salvage this?
And if you are actually diligent enough to restart, it means you most likely may have to trash everything you've done. And that's a waste of reagents, and time.
True.
Sometimes the place I work, actually, the turnaround time for most cultural tests, microbiological culture tests, it takes up to more than a week, and imagine someone waiting on that result to get treatment. It's just, I don't know the word to use, but yeah. So
that's on the less automated side, I'm guessing.
Yes. So automated parts. You come into a lab and it's not totally automated, but you know that most of the redundant processes are handled by automation, and you get to work with a clearer mind. When I first started working with SynLab, it felt like I was actually doing almost nothing. Do you understand? Because where I was coming from, you had to do virtually everything yourself. The only thing you're not doing is getting the result from the spec, because obviously you can't. Your eyes are not that advanced to the reading.
Yeah, but even that, you'll go to some places where they'll tell you that they can see the they can tell you the concentration.
I don't even talk about that. Yes, actually, but let's not focus on the non-ideal. Let's focus
on the better side.
So it felt like, when you are actually, it felt like I was playing a video game. Let me put it that way.
Playing what?
A video game with these machines. All you have to do is just load your sample, program, and move on to something else. It was good.
And then at the end, you just have to check and then make sure there wasn't a problem during the process.
Exactly. And if you're dealing with large batches of samples, normally something that would take 24 hours turnaround time, your results will come out in less than an hour. Less than an hour, like typically is full blood count. If you're doing counts manually, all the components of the test, the PCV, differential cell count, you have to, especially differential cell count, you have to manually stain the cell, all the processes involved. Then you take it to the microscope, get the counter. Some places don't even have that manual counter. Yeah. You have to get a pen and use I know we're using the tally system where you count 1, 2, 3, 4. When it's 5, you strike it off, you go again. All those things.
Yeah, that's how even my internships, that's how I did my internships. It was a tally system. Yeah.
Exactly. So but coming to the automated analyzers, all you do is just, when the probe comes out, you ensure your sample is in the right condition, and you load, and it gives you the results, everything, and as accurate as it possibly can be if all the conditions are right in the machine,
Yeah, so right there is one problem people usually, at least one problem people say they have with automation. You said if the conditions are right. So how do you, actually, before I even get to this question, in some situations we have, I've seen places where they get the equipment, right? They try to start getting more advanced equipment, but then they're getting false results, maybe because the electricity supply is not as, maybe there are increases, there are drops, or sometimes there's no electricity at all, or the room is extremely hot because maybe there are not ACs. And so sometimes people complain that, well, with automation, they can't be sure of the results. So some will tell you it's because the machines were made for cooler climates, cooler countries. And so as a result, when you run your tests, what you get may not necessarily be what you are supposed to obtain. So what would you say, like, in those cases?
Okay. First of all, it's not just about getting the machines, getting those automated analyzers. It's about the goal of automation is not just speed, it's not just profit. It's about producing the best quality results in the shortest possible time. So the key word there is quality. And these machines, before they are actually shipped, before they are sent out from the factory for production, they've undergone so many quality checks and quality assurance processes. Make sure that this is in the right condition to dish out patients' results. And a facility, ideally, a facility that gets an equipment, you don't just put it in use immediately. Yes, you have to pass it through some quality processes, correlation, to check for accuracy, to check for precision, and all the cascades of procedures that accompany the installation or activation of that machine use processes. Sometimes it takes up to a month before you can say, okay, this machine is good for go ahead. And it's not a one-time thing. So there is the internal quality assurance and the external quality assurance. So every day before you even start your day's work, the scientist is supposed to actually see this machine I have turned up for this number of times. Now I have turned it on. I have to check if the conditions are right to produce patient's results. And that involves using it to run commercially known values, which we call, some persons call standard, the manual procedures. You use this machine to run these samples and you have a particular result in mind. This is supposed to produce this result. If the machine gives that result, fine, it's good. It's assumed it's good to, it's giving you an accurate result on the patient sample. If it doesn't, there's no reason to go ahead to use it to run normal patient samples, and the external quality assurance, which there are several quality bodies that handle this for medical laboratories, and for many organizations, it's a monthly thing. Every month they send a sample to every lab that are registered under them. So you don't know the values of those samples. You just run it blindly, get a result, and send it back to them, and they send a monthly report. Okay, this was your result compared to other labs that use that same machine. Was it good? Was it not good? Those are continual processes that help to keep your machine in check, to see that you're giving accurate results for whatever you do. So yes, anyone who says the result is unreliable, that person probably has not done the processes to ascertain the reliability of that result. But if you have, there's no point getting scared of whatever results you produce. So,
yeah, because that's one thing I also realized, that many of these labs that tend to complain about this, there are labs where you don't necessarily have people that have the interest even to look deeply into those machines and figure out how they work. Because in some situations, it may be a setting somewhere that no one really bothered to check, that maybe it's just a button that you need to switch on or off somewhere that's going to allow you to get better results. But because people don't really bother to check, they assume that the machine comes in, it's advanced, and so you should be able to pass your sample and then your results should be able to come out. But it's actually the opposite. The more complex the machine is, usually the more you have to pay attention to details to make sure that what you are doing it's actually what is supposed to be done. Because if it's complex, then it does a lot of things. If it does a lot of things, then you have to be very careful about how you touch it and what you do with it. Now, there are some others who may complain and then say that they are very expensive. One thing though, I think one situation in which I will agree with some of these people is that if you are a smaller lab, then you shouldn't be jumping necessarily towards automation, because it also depends on the number of samples you have. That's also sometimes an error some people do, where they go and then they see this new piece of equipment and they want it, but maybe it's a high throughput. Maybe it needs like a lot of samples. Maybe it's something that needs to be on 24 hours a day. If you don't receive samples 24 hours a day, then it's your electricity, especially in a country like Nigeria where there are already electricity problems. You are wasting your electricity. So usually, I think one other problem is labs don't necessarily take good enough count of what they are doing and the number of samples they have in different areas before they go and buy all those complex pieces of equipment. But for a lab where there's a lot of samples, of course, it makes a lot of sense.
Yes, you're right. And also, I was having this discussion one time with a group of medical laboratory scientists. Actually, the topic was why they pay medical laboratory scientists so low in some places. And someone said something that made a lot of sense. There's nothing wrong with having a kind of a joint partnership in setting up a lab. I have interest in setting up a lab, and someone around that area has an interest in setting up a lab. I don't think it's out of place if we put resources together, do something bigger than what I would have done or what you would have done if you were alone.
Yeah.
That way, we can do something bigger than our individual efforts. And the bigger the lab, the more attention it gets, the more patient volume comes, and then automation just makes everything smooth. Yes, but I understand also for sole proprietors and people who have labs, especially in rural areas where you don't get big volume of some patient volumes and all the rest.
Yeah.
Then there's no point going into automation, because it's more like you just want to show and at your own loss.
Exactly. Yeah, at your own loss. And I think that joint partnership idea makes a lot of sense. I've been thinking about for a while now. And it's true that, of course, if you are a lot more, like if you are like 5 people and then you come together, what you are going to be able to make is going to be much bigger than what you do if you're on your own. And I remember even a couple years back, I was thinking about it's not even necessarily that you all need to be focused on the laboratory and the technical aspects. Let's say you're 5, or let's say you're just 3. One person could even just focus on the pre-analytical process. They could decide, okay, I'm going to take care of going to different labs, to different places. I'll take care of the sample collection. I'll make sure everything comes down in the correct sort of containers that is transported correctly, is brought to the lab. Someone else could decide, okay, I'm going to be taking care of the laboratory itself. Maybe a third person is going to decide, okay, I'm going to be taking care of quality assurance, quality control. Maybe even someone else, okay, I'm going to be supervising the waste disposal and then taking care of that option. But for some reason in our countries, I don't know why, but people don't necessarily want to work together. Maybe they think they are going to be cheated, but I mean, at the end of the day, if you have a contract and then everything is spelled out in the contract clearly enough, that should be enough of a basis to at least start working together. At least it's a beginning to start something, but it's hard to get people to actually want to get together and start doing the work.
It is, seriously, and I think it's a mindset thing too, because a typical African, a typical Nigerian does not want to see this other person doing good. This person is doing good. I'm like, why? It's just, I don't know where it came from, but it's just something. But coming together, getting a lawyer involved, you guys have a deal. Everything goes on. It may not be as easy as it sounds, but it's doable and it's better actually. Especially if you don't have enough resources.
Especially in our countries where you have a lot of people who go to university, they'll get their bachelor in medical laboratory science, and then they'll work in a bank. So at the
Yes.
end of the, why not get together with some others? Because I think if you get together with others, maybe at first it's not going to be as, you may not make as money, but with time, as more and more people get to know you, you're an owner in a company, so you're going to make a ton more than you would have just by staying like in a bank. But it's not necessarily something that people tend to look at very often. And I
Yeah.
think that's also one of the reasons why a lot of us don't necessarily have good salaries. And also the salary thing, I've always thought that one issue may be also some of our associations. Because at the end of the day,
Yeah.
normally when you have an association, the role of the association is to bring people together and to try and make the profession better. Part of that is ensuring that people have better salaries and actually go and possibly lobby the government. But even if it's not the government, even on the private side, let's say, for example, you had a, because I know you have an association in Nigeria. Let's say leaders in the association came and then they sat you all together and they said, okay, from today for a complete blood count, we don't accept less than X amount of naira. That's what everybody needs to do. In the end, it's going to benefit everyone as long as it's not so high that people are not able to pay, but it's something reasonable. I think people are still going to follow that. But our
Yeah.
associations, for some reason, they too, in most cases, sometimes I wonder why we pay dues because I don't see exactly what they do.
Of the deals.
Mm.
It's so sad, and it's pathetic because there's this platform I am in on Telegram. It's just a group of medical laboratory scientists
Mhm.
who are looking for opportunities and who also post opportunities, in Nigeria. So we usually have discussions now and again. Now, one time someone posted a job opportunity. The salary was 40,000 naira. 40,000 naira is less than currently. It should be about $80.
Mhm.
And someone was like, really? Why will an employer give someone who has stayed 5 years in school, 1 year internship, you have the
Yeah.
qualifications, why will you get $40? And some person said like, well, if it's an upcoming lab, what do you want the person to do? That's what the person can
Mhm.
afford to pay. And I'm like, yes, that's what you can afford to pay, but there's no rule that says you must do this on your own,
Yeah.
you know. And but the sad thing is you still see people going for those
That
roles.
that's what I was about to say. They are going to do that because they know that there is someone that really needs the job that's going to accept
Yes,
that job no matter what. And the associations are not really pushing set a certain standard so that people are paid at a given standard. So anyone can choose whatever price they want to pay you. And they know that there's someone somewhere that needs the money that doesn't have anything that's going to come, that's going to apply, and that's going to do that job.
it's ridiculous. Yes.
Yeah. But then the labs that are actually paying people are the ones where we can have some automation. But let's say if a general lab, from what you have seen in Nigeria, a general lab that wants to get into automation, that is thinking about that, about automating some of their processes. What is,
Okay.
according to you, usually the area where it makes the most sense? Is it more on the biochemistry side, on the hematology side, just based on your own experience?
Well, I would say it depends on the hospital, the organization, right? So there are some places where they deal with more of children
Okay.
and probably pregnant women, some specialized kind of hospital. So in those places, you get to have more requests that are in towards the hematological line because there'll be more blood transfusions, pre and post surgical procedures that will involve blood, PCV, everything around hematology. A lab is being set up in those kind of areas. It would make more sense to automate your hematological procedures because yeah, that's where the demand is most. There are also some places where you have more or just a balance, or more of chemistry there. So I think it's just the thing is for anyone to go into these procedures to know what to automate, you have to know the influx of which area comes in the most. and you automate those areas. That's what I think is best, because like we said before, it won't make any sense automating something that you're not making profit from. And some of these reagents, they have expiry dates. So if they are not used up within those expiry dates, you get to throw them away, and that's a loss on your side. So there's no general rule to automate or not to automate. It's just depending on the particular setting, I think.
Yeah, I've seen labs where they've had to throw reagents in the past. Yeah. If you are not set up, if you didn't do your analysis well enough before buying the equipment, then that's likely going to happen because you can't use it. You can't actually use it unless you want to call people and then do some free tests for them. Then
yeah, true. And it's the choice of getting a particular automated equipment. It's even beyond just patient volume. The kind of equipment also matters. There are some open-ended equipments where you can get reagents from virtually vendors that produce manufacturers that those reagents commercially, and you have a flexibility of choice. But there are some that are closed. They are a closed system and they are patented.
yeah.
So you can't get those reagents anywhere else except the manufacturer. So there's a whole lot about it. There's a lot of research to be done before settling for a particular equipment.
Yeah. I usually try and stay away from those that are not open. I've always liked open equipment systems because I know that I can go anywhere. Like if, for example, there's a problem, I know that there is another supplier somewhere that I can have access to. And also for the closed equipment systems, usually, I guess, well, it depends on the kind of testing you're doing, but let's say it's for immunoassays, they're going to have a certain kinds that they offer. And if you want to do anything else, then you need to buy a different equipment in order to do that different thing. So something that you have to take into account. Yeah, like you said, when you're buying. Now, assuming there are labs that want to get more into automation, how would you advise that they go about it?
Okay, first of all, they are experts on setting up automations for organizations.
Yeah.
Yes. So get in touch with those experts, talk to them. They'll come to your facility, do a survey, and let you know the best choice of what you need, what you don't need, how you go about what you want to go about. So talking to experts are the first step to go about it. Even before doing your market, most of them will help you save a lot of time, and a lot of money too, because you don't have to do trial and error. Most persons buy some equipment and you find out that over time they are not really as accurate as the media or their advertising agents project it to be. So talking to these experts, they have experience, they've seen what works and what does not work.
Yeah.
So they will guide you and let you know what to go in for and what to avoid. Yeah, and there's nothing wrong with going to talk to a particular lab or organization that has what you want. Yeah. There's nothing wrong with that. Yes, most people will be scared of competition to give out certain info, but I'm sure they can give something that will help. The space is too wide to accommodate. It's wide enough to accommodate everyone. So just talking to people, not just relying on research online. Most persons, they want to get equipment and they go online to read reviews or go on YouTube to check. Most of those reviews are paid reviews. They are paid to say good things about those equipment, and at the end of the day, they will not be as good as they sound to be. Yeah. So getting with experts is good, but medical engineers too are ways to go, and it's not a one section thing, especially automation. If you're willing to go into automation, then you have to be willing to get a service or to get someone who will be in charge, especially of the maintenance of that system that you're bringing in. Yeah. And Yeah, so basically just getting across to the experts. One thing that's just the first and major step to go on this.
Progress. I'd like to thank you a lot for taking the time to speak to us today about automation. Do you have any last words for anyone that may be watching this?
Yes, I do. I want to say, as medical laboratory scientists, we are not limited to just the bench. We're not limited to the routines of putting in samples, taking out samples. Automation is one area where if we have more medical laboratory scientists going in, it's a field that is massive, it's vast. So most persons can decide to um, do their postgraduates in this field. Trust me, it's something that we really need, especially in this part of the world, Nigeria, Africa. It won't be bad if we have our own indigenous companies that are manufacturing these machines,
Yeah.
for easy access and all the rest. So automation is one actually an area that is quite neglected in our educational system, and I feel we should pay more attention to it. The last words.
Thank you. And where can people get in contact with you if they want to?
Okay. LinkedIn, Progress Promise-Birah, Facebook, although I'm not really active on Facebook. But if someone drops a message on Facebook inbox, I'll definitely get it. But LinkedIn,
Yeah.
there you can fastest on
Okay.
LinkedIn.
So thanks a lot for being here with us again today. So lab experts, you've heard it. If your lab is not automated, try and look into that, try and talk to some experts, try and make sure you try and increase the inflows of samples to your lab so that you could actually be a part of the revolution that's happening in medical laboratories, because in this century, things are moving a lot, very extremely fast. And the laboratories that have the best throughput, the laboratories that have the best quality are the ones that are going to thrive. You need to make sure that yours is